Esther, and my topic is diverticulitis. I'm sure we all remember it from Mr. Lee's advanced class when we learned about lower GI diseases and infections. So I'm just going to be going into further detail about diverticulitis. So I guess let's get started. What is diverticulitis? I can't explain it without explaining what diverticula and diverticulosis are first. So pretty much diverticula are outpouchings of the mucosal wall that could result from the herniation of the inner wall of the colon. Um, Diverticulosis is the colonic diverticula, which are just the ones I said before. Um, and they have multiple small outpouchings along the large intestine. Um, Diverticulosis is a diverticular disease, and it can result in abscess, fistulas, and perforation of the colon. This is more common in people over the age of 60, because diverticulosis does increase with age. It's very rare in people who are younger than 30. Um, Diverticulosis occurs pretty much like if you're having to exert yourself while you're trying to pass a bowel movement. It causes a lot of pressure in the colon, in the lumen of the colon, and it'll cause you to have those like diverticula. Um, and it's very common too in people who like consume very low fiber diets and like low bulk meals. Um, and it is more common in the sigmoid colon as well. I'll get into further detail about that on my next slide. But because of diverticulitis is a complication of it. Pretty much all those little outpouchings, they get inflamed. And this is usually caused by like retained fecal matter in the diverticulum, which I know it sounds kind of nasty. Um, but yeah, like pretty much just the fecal matter gets trapped in the diverticulum by the narrow opening of the neck, and it causes that inflammation of the mucosal lining, which then can lead to the perforation of the diverticulum. Um, and so, yeah, diverticulitis can be a really big complication and it can be very serious, if not taken care of. But let's see. So again, this usually does occur in the sigmoid colon, and the inflammation of the mucosal wall leads to perforation of the diverticulum, which can lead it to like localized peridiverticular abscess that can be walled off by fibrous adhesions. Um, and this inflammatory process could localize within the wall and produce an intramural mass, or it could dissect around the colon, causing that narrowing of the lumen, which you'll be able to see on um, like X-rays and CTs and stuff like that. Um, a common complication of diverticulitis is development of fistulas to like adjacent organs. So like your bladder, vagina, ureter, small bowel. Um, so yeah, and I'm sure it's very painful, and I'm sure nobody wants to have to go through that. But again, it is very common in people over the age of 60 because, health starts deteriorating the older you get. You take care of yourself less, you're not eating as much, and so it can cause all of those issues. But up to 20% of patients with diverticulosis can develop acute diverticulitis, um, which it's not a very big number. Um, but I'm sure for those 20% that are having to deal with it, it has to suck. So I do feel for them. Um, Here recently, my own mother has been suffering with diverticulitis, and it's turned into chronic. Um, and I see how much it affects her, so I can only imagine how it can affect other people. So it is pretty painful to have diverticulitis, but some of the symptoms of diverticulitis are sharp pain, often in a localized area. So more than likely, it can be like in the lower quadrants of your abdomen, since it does pretty much affect the sigmoid colon the most. You can have nausea, vomiting, fever, uh, distension of the abdomen, which pretty much like you'll look bloated, and it'll be very painful. Some patients do have, you can have like diarrhea with it, or you could have constipation with it. It all just kind of, I guess, depends on how the diverticulitis is affecting you. But you could have like severe diarrhea, and you could have, again, blood in your stool, which can be an indication of diverticulitis. Um, and so, yeah, those are just some symptoms. If you or a loved one is experiencing any of this, I highly recommend going and seeking some help. So, I have some like radiographic evidence for um, diverticulitis. So, the most specific sign for diverticulitis on an image is extravasation. Um, it can appear either as like a tiny projection of contrast material from the tip of diverticulum or as an obvious filling of a pericolic abscess. Um, so I'm not sure like if you can really see it on this image. Um, I tried putting images from the textbook, but unfortunately I'm not very tech savvy and I didn't know how to do that. Um, but a more common sign of this is like um, it is more common, but it's like a little less specific. When it comes to diverticulitis, is like the demonstration of a pericolic soft tissue mass that has the same attributes as a localized abscess and can represent like as a walled off perforation. This extraluminal mass can appear as like a filling defect, causing eccentric narrowing of the bowel lumen. So it'll make it tinier, like in this picture. And you can kind of see like it's very stringy compared to the top of the large intestine. Um, they are very, these type of diverticula can be very like spastic and irritable. And they frequently like drape over the mass. Um, it is very, excuse me, it is very important to remember that like, oh, excuse me, peridiverticular abscess caused by diverticulitis can occur without radiographically detectable diverticula, which means you could have it and the x-ray might not be able to like pick it up. Um, so it is a possibility, but pretty much if you're doing like a barium contrast study, it'll look like barium-filled pericolic masses or spilling of contrast from the colon into the abdomen. So it'll kind of look like it's branching out of the abdomen, kind of like when you spill a drink, how it just kind of drops out. It'll be the same thing with the diverticulitis. I did choose to also add ultrasound. I know it's not really one of our modalities for our program, but I didn't realize that with ultrasound you could find diverticulitis, so I thought that was kind of cool. It would show like a hypoechoic. I don't know if I'm saying that correctly, but it's a hypoechoic projection that arises from wall of bowel and is surrounded by fat that is inflamed. So I'm not sure if you can kind of see like the diverticulitis. Honestly, I have no clue what ultrasounds show, so I can't really pinpoint exactly on there um, where the diverticulitis really is, but I'm hoping that you can see it. Um, so for CT as well, I didn't realize that you could catch diverticulitis with CT. Um, so that would show pericolic fluids and gas collections with colonic wall thickening, producing a narrowing of the bowel lumen. So here, thankfully, there's little arrows kind of pointing where that diverticula is, and it's very like non-specific colonic wall thickening. that produces this like narrowing of the bowel lumen. And so you can also see like inflammatory stranding due to like this fat that gets inflamed from the diverticula. Um, Now, if you suffer from diverticulitis, there's a lot of times where you'll have to get like colonoscopies done to get further examination of the diverticula in general. And surgery may be required when it comes to this because of the perforation. If it's really serious, you will need to have surgery. So, yeah, having a colonoscopy is another thing someone can get when it comes to diverticulitis. Treatments. So, pretty much the first step for diverticulosis is non-invasive treatment. So, pretty much cleaning up your diet can help with um, diverticulosis. So, like getting rid of nuts, popcorn, nothing with seeds, nothing super fatty. Um, yeah, not greasy food, stuff like that. All of that, cleaning that up could help with diverticulosis. Also, exercise. So, exercising daily, going on walks, um, all of that can help with managing your diverticulosis. So, if you end up with diverticulitis, you do require like antibiotics, and they do try to put you on a liquid diet until your diverticulitis has healed. My mom was one of these people. Her diverticulitis was really, really bad, and she couldn't keep any food down, so they put her on a liquid diet for about 2 to 3 days. Um, and it helped a lot. It does help with keeping your colon from getting even more inflamed from all these foods that are trying to pass through it. And so yeah, liquid diet will kind of help keep that inflammation at bay while the antibiotics are trying to get rid of it completely. And again, if perforation does occur, surgical repair will be required and you will be given antibiotics. Um, Again, my mom is headed towards surgery because she's developed chronic diverticulitis. So hopefully surgery will help. But again, for everybody, diverticulitis can be different. It's just kind of trying to control it once you have it. But yeah, that's pretty much what diverticulitis is. Um, I mean, hugs and kisses to all you guys. I hope y'all enjoyed my PowerPoint if y'all actually listen to it, because I understand there's 24 other PowerPoints to listen to. But thank you for giving me the time of day and things like that. And I hope to see you guys soon.